Thanks.
Hello, and welcome to PK's webinar on personalized care with clinical business intelligence. Before we get started, I'd like to remind everyone that all attendees have been muted. Today's presentation will be recorded, and we encourage all attendees to get involved in today's webinar by including any kind of questions that may come up in the Zoom Q&A tool. I'd now like to introduce our speakers. Paul Lajeunesse, PK's VP of Strategic Accounts in Healthcare, Colin O'Neill, PK's VP of Design, and KG Submaranian, PK's VP of Healthcare Solutions. And at this point, I'd like to hand things off to Paul to get us started.
Thank you, Elizabeth. Hi, everybody. This is Paul Lajeunesse. I'm going to take maybe just the first 5-10 minutes, provide a little bit of an overview of PK just for context, and then share a few ideas around our thought process around the personalized care framework before I turn this over to KG and Colin, who are going to carry the bulk of the conversation and really get to some of the important content I think that you'll find hopefully very interesting and engaging during this webinar today. So without further ado, a couple things on PK. Many of you, I'm sure, in the healthcare environment have been familiar with technology purchases that just didn't deliver the anticipated value. You know, PK has been delivering technology solutions for many years, and we've taken the approach of leading with great experience, understanding the strategy and the design necessary to deliver an experience, and then providing technology solutions around that in order to accelerate outcomes and really help you achieve results with your technology investments. And today we're going to be talking about, how that plays into, capturing data to drive personalization in the healthcare continuum of care. So a little bit about PK. We are a global organization. We have offices around the world. We provide, again, end-to-end services from strategy and design through intelligence and analytics. Do a lot of work in experience platforms like Adobe and Sitecore. So those content management platforms where content is designed and held for mobile and web experiences. We provide development and engineering and operations and support as well. And the interesting thing is we span many industries, so not just healthcare, although we work with several of the largest providers in the healthcare space. We also do a lot of work in technology and media, telecommunications, and retail. So we're able to bring quite a few lessons learned from those organizations, those industries that have been through a digital transformation journey on the curve several years ahead of healthcare in many instances. So it's valuable insight that we bring to the discussion. And we're happy to say we've been the recipient of several great awards around loyalty and design and analytics. So we're proud of our work and the experience that we bring to this discussion today. In the area of healthcare, we're very focused as a partner on supporting the important mission of digital transformation. Obviously, in order to thrive and survive in a evolving reimbursement model, one that's risk-based and value-based, it's going to be essential to be able to capture data and leverage it to drive outcomes. Today, we're very focused on the first three columns on the left. So consumerization and loyalty, building trust in loyal consumers, personalization, engaging consumers across the continuum of care. And we'll talk about that a little bit further in the discussion today. And then modernization, how do we use tools like AI and machine learning to drive better outcomes and drive personalization that improves the quality of care and your financial outcomes as a provider. Okay, move right along. I'm going to spend a moment talking a little bit about the personalized care framework and how we view it. So there are several aspects of achieving kind of the objective that we talked about, moving from a patient to more of a consumer mindset. The first one is discover, and we look at this as kind of the first state, discovering each other. patients coming in or prospective patients coming into the organization and wanting to understand more about you and you wanting to learn about them. It needs to be simple for them to discover you, and we'll talk about a little bit about that moving forward, how that happens. Access next. KG and Colin are going to carry the ball on these next three, but how do they access care easily? How do you engage them then as a patient for follow-up? And then at what point do you promote to them? Are you able to promote either to an existing patient for additional services or for prospective patients to come into your organization and become a loyal and engaged a patient and consumer of yours moving forward? So I'd like to touch on, first of all, the idea, kind of the end game here is this connected, seamless human experience. In order to create an environment that's not only engaging for patients, but that one is that conducive to sharing of information is needed across the continuum of care. It needs to be a good experience for the patient, and it needs to be a connected data experience for you as a provider, so you can take advantage of the interactions and the data that's captured to drive decisions and drive outcomes. The challenges that we see are many, and they're very real, from too much data to too little to not relevant, not connected. Our organization's too IT focused. We have disparate technologies. We have a lot in the data warehouse, but we can't get at it, and it's too expensive. And many others. And these are all very real concerns. We would say that none of them are insurmountable. And although cost is an issue, the cost to the organization of not investing in this transition today is substantial. Again, as we move from a cost for care to more of a risk-based and value-based environment where you're going to benefit from driving value in the organization, right? And managing cost. So this is I have just a couple more slides. This is a visualization of how we see the consumer experience. And really it's the sum of all the interactions from, initial interactions, pre-acute, looking at wellness and fitness, smoking cessation, potential, prospective and existing patients doing some research to try to figure out if your organization's a good fit, through acute and then post-acute. And the bell curve represents not only the modality or point of care, outpatient or at home on the left, inpatient in the middle, and post-acute on the right, but also the cost of care. So in an ideal scenario, we're gathering data and helping you make decisions in the pre-acute and post-acute stages of the continuum, keep these patients out of a very costly acute care setting. So managing care through wellness programs, smoking cessation, diabetes management, managing post-acute care via, medication management and engagement with the patient in a way that's going to be effective to keep them from being readmitted into your organization or developing, more significant complications. Any comments from my panel? You want to add anything here? Are we good to go? Okay. A comment on how we view data and personalization. So we don't really necessarily, personalization is a goal, but we lead with personalization. In my opinion, in our opinion, loyalty is really the objective. And loyalty occurs when somebody is fully engaged in their care and they're actively referring your organization to other people. That's how loyalty is often defined in other settings as well as in healthcare. So to start that process, we do lead with personalization when we're looking at a technology application. We lead with things like defining personas and defining journeys for the patient, identifying those moments that matter. So in a healthcare setting, scheduling an appointment, finding a doctor, getting your results, getting a prescription, a number of different types of interactions where the patient or prospective patient is going to be very interested in having a positive experience. And then identifying what data do we want from that interaction. That's a very good starting point for creating an initially personalized experience for that patient that forms perceptions, that promotes engagement. And as that occurs, more information, more data is captured from that patient or that prospective patient, and the value of that data is enhanced. And tools like AI and machine learning can be applied to that to even further increase the value of that data and drive the personalization cycle, right? So ultimately, again, the goal is loyalty through an ongoing process of providing positive experience, driving perception and engagement, and using that data to continually personalize that care. So in an inpatient setting, a clinical setting, you have a ton of data before that patient even comes in the door that's going to help you provide a more positive clinical outcome when you're treating that patient, either prior to the surgical or the acute experience, or while they're still an inpatient, or certainly as they become their discharge and go through the discharge process. So one more slide for me, then I'll turn it over to the team here. A little bit about that first stage in the personalized care framework, enabling discovery, right? So the term omni-channel discovery is used a lot today. I think we're all used to multi-channel discovery, where you pick up a phone or get on a mobile device or get on a website and you interact with an organization. Oftentimes it doesn't feel very connected. Oftentimes there isn't data being shared that might make that experience more relevant and more personal. So omni-channel refers to the idea that these modes of communication and interaction are connected. And so that the patient or the prospective patient has a connected experience. And you as a provider, whether it be external to the facility or internal in the situation where you're capturing clinical data, you're able to have a connected experience as well in terms of understanding the patient, capturing the data, and learning more and becoming more closer to that patient and their needs. So that's what we refer to as the omni-channel discovery process. And it's really an essential, I think, shift in order to provide true personalization and capture the type of interaction and data that you're looking for to drive outcomes moving forward. So with that, I'll go ahead and turn it over to KG, who's going to talk a little bit about enabling access, engagement, and promotion.
Thanks, Paul. Thanks for that great introduction. Good afternoon and good morning to folks who just joined. Paul briefly touched on the personalized care framework. He covered some thoughts and ideas on the discover portion of this particular framework. In the coming minutes, what I'm going to do is I'm going to add some additional color to the personalized care framework, walking you through some examples, how we can apply AI and ML, what's the implementation complexity, and what outcomes can one expect. But before I get on to any of that, one of the points I want to mention here is, in a recent survey of adults, there were 3 important factors that were identified in terms of selecting a hospital health system. The number 1 was convenience, number 2 was cost, and number 3 is reputation. So in addition to the omni-channel discovery that Paul was talking about, it is important to keep these 3 factors also into consideration. The second important point that I want to stress and add on to what Paul was saying related to mutual discovery, and this applies specifically to the hospital health systems, is the price transparency. Starting January of this year, in fact, January 1st of this year, each hospital operating in US is required to provide clear and accessible pricing information online about the items and the services that they provide. And CMS expects you to do that in 2 fashions. One is, a comprehensive machine-readable file. That's a little boring. We'll not get into that. But the more important one is a display of shoppable services in a very consumer-friendly format. So this executive order, which has pretty recently come into effect, is adding more importance to the discovery phase of the personalized care framework. Having said that, now let's talk about one key glue, one key ingredient that is essential in terms of enabling the discovery. And that is, we need to have rich data about the patient or the consumer before which we can start to personalize the patient engagement experience. So we kind of see this as in two broad buckets. One is for an existing customer, we can mine the clinician, financial, and operational data, and we won't be violating any other HIPAA provisions as we are covered under the treatment, payment, and operations umbrella. And the typical data domains could include demographics, insurance, location, health risk, life stage of the consumer, and caregivers. For new customers, instead of trying to capture all the information in one shot, what we recommend is give them progressive nudges to capture the overall digital profile. So for instance, we are displaying a very simple sample registration form, which is very, very non-intrusive, and it does not ask for a lot of information. Once the patient is logged in and once we are able to engage that patient, then we can offer user experience cues to capture additional information about the consumer. This allows us to put the consumers in control of how they would like to engage rather than what information that we want to collect. This aspect of engagement framework from an implementation standpoint is not very complex, and we would rate the complexities to be more in the medium bracket. The typical systems that the hospitals or the typical applications that the hospitals need to integrate with include patient registration systems, your profile management, your notification platforms, and of course the digital front door. And in practice, what you've seen is when you take this type of an approach in terms of progressively enriching the consumer data, it definitely improves in your conversion rates, it improves engagement, and it also increases the customer acquisition. Paul, if you could go to the next one.
I'm sorry, I locked up here for a minute.
Thank you.
Hang on a second here. Hey, I'm sorry, guys. I locked up here. Oh, there we go.
Oh, there you go. All right. We got it. So now let's talk about the access portion of the personalized care framework. In essence, what this is enabling ease of access to the services that are provided by the health system. The table stakes for doing a good enough job are things like an appointment notification. It's not once and done, but you have to have a periodic appointment notification at multiple predefined intervals to reduce the no-show rate. Information about the consumer can be used to mine for patterns on patients who are no-shows. The features, that means the data items that one would look at to predict this particular no-show could include available demographic information, coupled with a whole bunch of other items that we could enrich the patient profile data, such as social determinants of health, the frailty of the patient, the dependence on the caregivers, etc. Another important point that I want to stress out here is providers' available time. It's a perishable commodity. So in addition to using AI and ML to predict the no-show rate, we can also look at yield management techniques, such as the ones that are used by the airlines. What happens if the patient doesn't show up? So even for the patients who miss those appointments, what we recommend is a proactive outreach. And proactive outreach in terms of all the available channels, and to figure out any other modalities that you can think of to re-engage the patient. Maybe perhaps like a virtual urgent care setting. For patients who have access to the mobile application, appointment reminders can additionally be added to the mobile application, like you demonstrated on the right. In terms of implementation, we would rate the implementation difficulty as medium, and the typical applications that are involved in this implementation include EMR, your analytic platforms, your notification platforms, and interface engine. Bottom line, when this is done right, this has the potential of improving the health outcomes, lowering the cost, and increasing the brand value and loyalty. Paul, if you go to the next slide. All right, so now let's talk about the engage portion of the personalized care framework. There are multiple mechanisms and modalities that are available for us to engage with this particular patient. Oftentimes, we hear that, we get more reminders from a mechanic in terms of oil change reminders than what we get from doctors. While this can be very frustrating, this also provides us with an opportunity to engage better. Broadly, when you talk about the personalized care recommendations, it can be put into three broad buckets: preventive, behavioral, and chronic care management. And sample use cases under all three buckets are illustrated in the slide. So when you build on the digital engagement profile and the clinical data, we can identify the care needs at an individual patient level for an outreach. Multiple care needs should be addressed so that they can be fulfilled in a single appointment. So there is a certain amount of grouping that you can do wherever it is possible. This reduces the friction in terms of engagement, but also makes it an optimum use of patients' available time. While population health platforms can be leveraged to identify unmet care needs, AI ML models can be created to predict disease progression and additional interventions that are warranted. As an example, let's say take of diabetic patients, and you look at the lab results, and you can look for some very specific markers, and you can figure out if the patient is progressing towards a chronic kidney disease. So this is an additional alert that can be given to the patient in addition to the three broad buckets that I briefly touched upon. For organizations that have a mobile application, it can be used as a mechanism, once again, to provide a gentle nudge to engage with the patient. So we're showing some fairly rudimentary examples here in terms of a patient who's obese. So we're giving some ideas in terms of nutritional counseling. And depending upon the time of the year, we're also reminding the patient about the seasonal flu vaccination. Implementing this is a little bit more complex than the other aspects of personalized care framework that we kind of talked about. The applications within the health systems that we need to touch on includes EMR, pop health platforms, machine learning platforms, notification platforms, etc. This is a very critical aspect, and when this implementation is done right, it can have a huge impact on the risk reduction and management of the patients. It promotes better loyalty and engagement. And this also is an essential component for any healthcare organization that is participating in a value-based arrangement, such as an ACO or a CMS, MSSP types of programs. Paul, if you could go to the next one. Thank you. So some of the aspects that I kind of touched upon, they were more, and if you remember the care continuum, they were more on the pre-acute or on the ambulatory side. Now let's touch upon some of the mechanisms and options that are available for us to engage with the patients, both during acute as well as during the post-acute settings. This is an area that's often ignored. Providing and caring for patients does not stop when the patient leaves an acute care setting. Follow-up after a hospitalization or an ER visit is essential for ensuring that the patients are following the treatment regimen post-discharge. Multiple ideas are there. Simple ideas could include things like, is the patient adhering to the medication regimen? Are they undergoing physical therapy post-surgery? Are they taking care of the surgical wound? So on and so forth. So this idea of care transition is an important aspect from an engagement standpoint. This is often overlooked, and it is especially important when the patient is transferred from an acute to post-acute area. And if the organizations are different, the organization that is providing an acute care is different from an organization that provides a post-acute care, this becomes even more important. Studies have proven that proactive follow-up when post-discharge has the added benefit of reducing hospital readmissions. We can use machine learning models, and we can identify the cohorts who are most likely to be readmitted. And we'll give you some use cases a little down the road. Follow-up can be prioritized for those patients who are identified as high risk for readmission. This approach not only promotes empathy, but also makes great financial sense. Hospital treating Medicare patients should be very well aware of this as part of the CMS Hospital Readmission Reduction Program, which oftentimes does not pay for readmissions that are not warranted as necessary. This can be a moderately complex area to implement with integrations with EMR, the notification platforms, interface engines, as well as AI and ML platforms. So Paul, if you could go to the next slide. Thank you. So now let's talk about the final aspect of the personalized care framework. And this is in terms of promotion. And three broad topics here. One is the health and social needs assessment, closing the referral loop, as well as building awareness of the healthcare service lines. Let's briefly look at each one of them. In terms of health and social needs assessment, it's something that should be incorporated as a good practice during scheduled visit as well as during wellness visit. This will not only enable personalization of services, it will also have the added benefit of enhancing Medicare risk adjustment. Knowledge of social needs would also help the healthcare organization help the patients navigate auxiliary community health service providers, such as home shelters, substance abuse centers, counseling, etc. The next topic in terms of promotion is closing the referral loop. Following up on a routine basis is absolutely essential to ensure that the referrals are consummated. It's not a fire and forget type of a scenario that hardly ever works. In addition, when you have the right type of follow-up, it will give you additional insight in terms of why a network leakage, if at all it is happening. What are the causation factors? Is it because the specialists are not available in the specific geography? Or is it the bedside manner of the specialist? So on and so forth. And once you identify these causation factors, we can implement some remedial actions. Building awareness of the healthcare service line. So this is another aspect of promotion, fairly obvious, but not implemented many times in practice. So examples could include a referral to an in-network physical therapist post an orthopedic surgery, promoting a birthing center for a pregnant woman, selecting pediatrician as part of the postpartum care. So these are all examples of building awareness of the other service lines that healthcare organizations might have. In terms of implementation, it's not complex. It's fairly medium. And in addition to EMR, you would now bleed into experience and management platforms such as Adobe Experience Manager or Sitecore, and of course the notification platform. Overall, when the promotion is done right, organizations can expect increased loyalty, reduce revenue leakage, and will have the ability to upsell other service lines. With that, I hope I've been able to define and clarify and give you some examples of the personalized care frameworks, along with some use cases, and supplemented by how AI and ML can be used across the spectrum of the personalized care framework. With that, I hand it over to Colin to bring it all together. Thanks, everyone.
And thanks, KG. Hi, everybody. This is Colin O'Neill. I'm a VP on the design team. And I wanted to talk a little bit about how you actually start, how you knit those things together, and then how do you make the personalization decisions that are appropriate for your organization. So we'll start on the next slide. We'll take a look at a definition of patient experience. I think this is from the Barrel Institute, but they define it as the sum of all interactions shaped by culture that influence perceptions across the continuum of care. That's a lot, right? That's a big thing to wrap your arms around. And one of the things that we see very consistently when we engage with our clients in this space is understanding how can you even start to do that in a really purposeful and intentional way. As KG went through the personalized care framework and talked about all the different platforms that are at play, it becomes a really significant undertaking. So one of the first things that we recommend is taking a human-centered or patient experience lens on this and start to look at the work that you're doing across this the personalized care framework and what you're doing with your data and your technology and how those are working together is really to articulate internally that this becomes a platform for understanding your patients. It's very easy to think of all of these tools as very specific point solutions, but ultimately the value and the transformation that has to happen is to knit this together in a way that helps your organization learn more specific, actionable, and value-oriented things about your patients and your consumers as they engage with you throughout the ecosystem. And so we'll touch on how you go about that I think it's also really interesting in this environment when we're thinking about clinical data to understand that kind of the growth of data around health in general has been really, really significant over the last number of years. And so that includes obviously everything that's accessible within the electronic health record and everything that an organization has access to under kind of terms of care coverage for clinical data. But there's a lot of data that potentially could fall into that category that the patients are generating themselves. They may have signed up for DNA testing with 23andMe or any of those other organizations. Many of us are tracking our workouts and other biometric data in incredible detail, whether it can be heart rhythms or anything else that all of the technology is allowing us access to now. So there's a wealth of data available, and what you really need to be understanding is how your organization wants to engage that and have a plan for how that's going to happen. And then when you think about all of everything that's available, the next layer is that business intelligence, that machine learning or the AI to start to help knit it together in ways that are actionable and accessible to your organization. So whether that is predictive analytics that might trigger certain personalized experiences or messages, or whether it's still kind of at a cohort level and kind of just addressing it kind of in those groups, there's a lot of value to be mined from all of this data when you approach it really in a human-centered and health outcome-oriented manner. So we'll talk about how we help our clients start that. And one of the elements that we use very consistently and has been very successful is what we call a service blueprint. We mentioned up front, the idea of starting with the consumer or the patient, creating a persona and mapping out the moments that matter across their journey. Well, a service blueprint basically has that journey as the top layer. But what it does is underneath that, it identifies all of the different actors and technologies and data sets that might be available or are in use at each of those moments. So it gives you a very rational way to look at a moment that matters for your consumers or your patients and understand what is available, what technologies are at play, and allows you to see the full set of actions around each of those moments. So the service blueprint is a process to create an artifact that gives you that accessible and structured way of seeing what's happening. One of the things we often find is, again, this feels too big. Everything is in motion. Everything has different initiatives, different constraints. It's important to democratize a view of what's happening, and the service blueprint allows you to do that. It's human-centered, but it traces those human moments all the way through your organization. If you can go back for one moment, Paul, I just want to touch on a couple of different areas within this. We talk about this as a framework to plan, capture, access, and act upon the data that your organization has. It's important to think about that. You want to orchestrate your approach to how you utilize your data to deliver the right kinds of experience. The service blueprint has a few different sections. We'll call one the line of interaction. It allows you to see, kind of what happens front of stage, for example, where are the patients and care delivery connecting together and in action. There's a line of visibility, which are things that a customer can see, but they may not be actively involved in. So that kind of broadens the focus a little bit to include other technical touch points, whether they be apps or websites or other areas. And then critically, kind of deep backstage, there is the line of internal interaction. And that's where the tools, the techniques, the processes, the integrations, the dialogue within your organization around that data is happening. And that's where we can start to understand what's available, where we are today, how can we move forward in a very positive way in alignment with those customer journeys. So it gives you a really, I think, the main thing that's valuable here is that it's accessible, and it gives you a way to have a conversation about everything that might be available to you at any given moment to provide additional value and to drive better health and business outcomes. So the chart over there on the right is obviously an eye chart. This is a very detailed look at a service blueprint that we developed for an organization. Paul, if you could move on to the next slide, we'll look at a very simplified version of this. And we'll talk a little bit about some of the key platform areas that are at play. So as KG went through the prior section, he talked about the complexity of making some changes to deliver the experience, and identified a number of the different parts of the stack or the platform that are at play. And so in this service blueprint, you'll see the red box down the bottom that just starts to identify some of those. But again, the value here is in how those show up in important moments within the consumer and patient journey. You'll see in the way that we've architected this simplified view, we're looking at a life cycle that starts with potentially a symptom or an interest, moves through kind of the upfront phases of the personalized care framework, that discovery phase where you're kind of in that consumer mode. You're looking for information, you have an important driver. But as KG mentioned, there's a lot of value that can and needs to be generated within this space. We'll touch on this a little bit more later just to see how competitive that space is becoming. But understanding when the people you're engaging with move from a consumer mindset into a care mindset, becoming a patient, going through that process, exiting that process, and moving back into a different mindset where they are going to be consumers of different types of information, different types of content, because they have to adapt to lifestyle changes and new normal and a new way of thinking and engaging. Again, the idea here is orchestration. How do you start to think about where important data is available, where important data needs to be collected so it can be acted upon at other phases in the journey, where value is being delivered at what level, and which channels you're going to use to deliver that value out to your patients and your consumers. So this method becomes really, really valuable when we start to think about how do we get started? Well, very often we'll find that many of our clients and customers are doing a really good job in a number of these individual elements, right? They're doing well in potentially in discovery or in intake, or obviously everyone is expert at delivery of care. This kind of moves you into a different environment. But also critical to understand here is that excellence in delivery in one area can be impacted by problems delivering in another area. And for healthcare organizations, who are focused on delivering care, in a one-to-one individualized manner, to have the value of that be diminished by something that might be more content, communications, technical delivery, mobile application oriented, is a real big impact, right? You want to make sure that you have at least a very consistent and coherent experience across all these different touch points. So if we go to the next slide. So what helps you knit all of that together, KG touched on this as well, is what we'll call a connected data profile. So understanding when you're going to add to that profile, when do you have permission to ask or access additional data, whether that's the clinical data or other types of input from your consumers and patients, becomes really, really valuable. Understanding how you're going to structure that profile with all the different inputs and outputs, and how then you're going to operationalize that within your platform. So here we're looking at kind of very broadly some different groups of data types that should be considered when you start to think about building that profile. This becomes kind of an organizational initiative level. You need to have connection across the different aspects of care delivery, the different platforms, in order to make sure that you're accessing and engaging the right types of data as you go. But the idea being that you are always focused on adding to this at the appropriate moment by those small nudges, those little requests, or even by some kind of AI that's diagnosing something within the customer journey that is an important point for you to have, whether that's a missed appointment or some other issues around scheduling. Those types of things can all generate insights that should be understood as being accessible and available to your team. We go to the next slide. I think another important aspect, and I think Paul touched on this at the start, is when you are delivering in a very personalized way, when you're delivering at a high level of personalized engagement, you have the opportunity to unlock additional data. So the more information you are giving, the more value that you're creating in its delivery, the greater the opportunity you have to unlock additional data. And so here we're starting to think about what we might consider an event journey. So in any given moment, what data may we need to generate in order to deliver something better further down the line? So starting to think about each interaction, each point of intersection within a channel as an opportunity to personalize the delivery. And when you do that well, capture something that you know you need to act upon later. And we'll give an example of that as we go into a little bit of persona-based storytelling in the next slide. So we mentioned up front, our approach always starts with human-centered design, understanding who are the actors in the system, how can we understand their needs, how can we meet those needs in the most effective way, and how can we then scale that insight and empathy across a large organization in a way that's manageable and in a way that is inclusive of all the different actors within the system. So following that principle, this is Lucy. Lucy's struggling with a diagnosis of heart disease. Lucy lives at home alone. She's retired. She has close family to help her out, but they're not always available. So she kind of navigates a lot of this journey by herself and needs support, but will be a translation point for information. So we look at top right, what her fears may be in this scenario. She knows she's going to have to make some life changes. She's going to have to integrate some new habits into her routine. We all know, just based on, I think, as we get older, that becomes a little more challenging for all of us to do. So, some demographic data, simple data around her age and her cohort and some of those social and demographic aspects can give us insight there. We may know that, either in specific or in general, Lucy and her people in her group could be overwhelmed by a lot of new medical information. That's a very general thing that we've seen across the continuum of care. When medical information is being delivered, it's often in a very emotional environment. It's very hard for people to have good active recall and capture all of the details. So if we're going to be successful with Lucy, we need to understand those needs, fears, and opportunities, and orchestrate the delivery of care and content and support in a very purposeful way. And I think what gets to be really interesting here is when you start to build the infrastructure to do this, you have some questions around what choices do you as an organization make? We'll talk a little bit about transparency of how you're using that data. We'll also think about, what are your brand's values? How do you want to show up in the lives of your consumers and patients in very specific, authentic ways that emphasize what your organization is really focused on, what you're really good at, what you really care about. So when you have this infrastructure in place, it gives you a platform to think proactively and creatively about how you might be able to scale and dramatize some of the things that you already do quite well at an individual level and scale those out across the continuum of care. So let's take a look at the next slide. And this is just, again, very, very high level view for the purposes of kind of getting the concept out there and having a dialogue around it. This may be, the part of the diagnosis journey for Lucy. So she heads to the ER based on some chest pain. She'll check in, and then we know she's probably most likely going to be alone. So there's a lot of downtime while she's waiting. Let's not ask Lucy to deliver a lot of information that we may already have access to within the organization. Let's pull as much of the relevant patient data in an automated way as possible, so we're ready to deliver that. Knowing that during the visit where she may be getting more information or a specific diagnosis, that's a lot to take on. There's a lot of medical terminology that she may not be familiar with. Like I mentioned, it's an emotional time, and it's hard for people really to think very rationally very often in those moments. There's opportunities to turn that conversation into something that's more accessible and something that can actually have a level of data that can influence how we help serve Lucy in the future. NLP here on the slide is natural language processing. If that visit is recorded, you can automate that transcription based on certain words that show up in that transcription. You can have certain tags that the system, the infrastructure can ingest and use to create an understanding of Lucy and how we need to serve her to be successful. So in this scenario, imagine there's an AI in the background, and based on that conversation, based on her specific patient data from the past, based on her social determinants of care and demographics, we may indicate that Lucy is a high readmission risk. The idea of being transparent with what you're doing with this data is really, really critical to continuing and extending the trust that you build between patients and care delivery. So in this example, the concept here is to let Lucy know that based on the conversations we've had, we think there's a high risk that she may be kind of visiting again based around this condition. But not only letting Lucy know that, letting her care team know that as well, and involving them in a dialogue around how do we utilize this automated insight, and how do we bring a conversation between Lucy and her care team together around that. So here in this example, the care team might be able to look at that automated marker and say, yeah, there's potential here, but I wouldn't say she's a high risk. I might think she's a medium risk. And so now they're pulled into that conversation. You're getting a little bit more data from them, and you're being very transparent between all the actors in the system as to what you're doing. And that leads us to the next slide, which is what you can do in that moment when you've kind of established that. So this might be an example of a personalized follow-up care experience for somebody like Lucy, who is determined to fall into a risk category. We talked about delivering the visit summary in an accessible way. Maybe there's a biometric bracelet like a Fitbit, or maybe Lucy has access to that herself, or a watch that's tracking some of this information. Let's establish other modes of connection that may be a little more automated, so that we can stay in touch, we can continue the communication, but we're not asking Lucy to make a lot of active changes immediately. And then examples of how you might act on that, looking at this kind of mobile app concept. Well, we want to make sure that Lucy stays engaged. So the idea of promoting the follow-up touch points in a really primary way becomes important. For another patient, this virtual follow-up messaging may not be top of the list here on the screen because it's not a top priority based on the decisions that we've made around how they're going to act. But for Lucy, we know that maybe enhanced control and additional visibility around this follow-up might be ultimately very beneficial. So we prioritize that information, and we'd make sure in this example that she knows that she has the ability to reschedule it. We've seen that when people actively engage in these appointments and you give them that ability, again, it can improve the outcomes for those moments. So prioritize that for Lucy, pull her into an engagement mode around that follow-up that makes it more likely that she's going to attend. We touched on the natural language summary. Maybe Lucy needs to share this with her other caregivers, her family, making that accessible, understanding that she's going to come back and potentially engage in this content, making that as easy to engage with and as easy to understand as possible. Again, increases the likelihood that she's going to spend time with it. She's going to have her family, her children, read it as well, so that everyone starts to get connected, and we start to increase the sense of clarity and purpose around this information for her. And then again, ongoing feedback, potentially the app or on the watch or a Fitbit are in communication, and we're just automatically taking those readings and keeping a record there. Again, that's been shown to increase engagement around the topic, help Lucy feel like she's in touch with things a little bit more, and starts to indicate ways that we can then track some of those data points for her and stay in touch and make sure that we're delivering the right kind of information and support at the right moments. And we'll talk real quick here, just some other examples of how then you might extend that, in that ongoing, delivery of care day to day. There's lots of opportunities when we have a fairly good engagement profile for Lucy to automate many other different touch points, both on the provider side and for Lucy herself. So here we see an example of a chatbot that is something that a nurse can activate. But again, in this example, we're showing options for Lucy to continue to engage. Right, we're promoting this idea of an immediate video appointment if that's what she wants. Right, we're knowing what we know about her, we're able to emphasize and turn up the volume on certain points of interaction. And again, having a platform that she's continually connected with, that gives her feedback that's actionable, again, becomes really useful to her, but critically also allows us to create more data, capture more data around how things are going, so we continue this kind of positive loop of feedback as we deliver hopefully a positive experience for Lucy, driving toward a positive health outcome. So those are just some examples of the types of things that we're discussing with our clients and working on. I did want to touch on a couple of other examples, because there are a lot of things that are happening in the space that could really lead to some fragmentation. For example, kind of in that upfront discover area, a lot of people a lot of organizations are competing in that space. This is an example of some work we've done with an orthopedic medical device company, where they are messaging all through the stages of the personalized care framework. So they're out there actively engaging your potential patients in a dialogue about the delivery of care built around their replacement joints in this example. So knowing that those things are happening, there is a potential cost to organizations if you're not being successful in this space. There's an opportunity that other organizations are going to kind of drive preferences or modes of care for your patients and your communities. So it's important to have a perspective and be active in that discover phase of the journey. There's tons of startups who are doing point solutions around different parts of discover and access. That becomes, again, a larger integration problem for large organizations, because they're going to pick up care at a certain point. You may only pick it up during an acute moment, and a lot of the insight that would have been available in the discover and access phase of the journey might not be accessible to you because they've been engaging with other players in that environment. On the next slide, we'll look at an example of some work we've done with a client of ours to build a mobile app for tracking diabetes information. And there's an AI behind this, looking at the data that's input from the diabetes measurements and capturing patterns that might indicate additional support being needed or risks. And then this platform indicates that both to the patient and to their care provider as well. So it's an ongoing way of collecting data, but then at the appropriate moments, acting upon that data to deliver value both to the patient and to their care provider, so that they can be on top of things without having to kind of have a very heavy lift in an ongoing way. So this is taking that idea of the biometric bracelet we talked about for Lucy and building it out to something more substantial, for a specific type of treatment plan. And then on the last slide, I just wanted to touch on one other sample project that we've worked on. This is a wellness dashboard for a large healthcare provider that we work with, really tailoring this so that we are helping their community and their market manage their health proactively. Lots of obviously, population health benefits of this. But again, if you also look at it as a platform for understanding, not only are you driving positive health outcomes, you are creating a level of insight about each of your patients that is going to be really, really valuable to help meet their healthcare needs in non-acute ways. So, and then if you do need to meet them in those acute moments, you have this rich history and you have a way of understanding them and where they've come from and how you can be successful in delivery of care with them. Those are just 3 examples of the many different types of things that we're doing with our customers and clients to help activate, create data and orchestrate it across the continuum of care in ways that are accessible, or starting points. And I think once you start with the right approach, you start with the right framework for how you're going to handle your data and connect that to the quality of the customer and patient experience you're delivering, you can then scale that across the other touch points. And when you see success here, you plug in other data that's available, you plug these insights and this way of delivering into other programs, across your delivery, and you start to build out, a model that grows in scale, grows in structure, and allows you to kind of grow in confidence in your use of these platforms, the data that they create, and ensuring that you deliver a really purposeful and coherent experience across as many touch points as possible in the delivery of care.
Thank you, Colin. I believe that's it for the content. That was some really, helpful and very great insight into the personalized care journey. Were there some questions, Elizabeth, that we may want to respond to from the team?
Yep. Yeah, thank you, Paul, and thank you also to KG and Colin for presenting today. So yeah, before we close out today's presentation, just want to address a few questions that popped up from today's audience. The first one was an attendee wondering if the EMRs with the additional modules provide most of the functionalities that you spoke about. And I believe this would be best addressed by KG.
Oh, thank you, Elizabeth. And thanks for the question. That's an excellent question. And this is something that we get asked often. Now, if you kind of look at an EMR, they do have modules, especially as it pertains to some of the notifications, some of the interface engines, and of course, predominantly clinical data capture. But if you go back to some of the preamble that Paul was talking about, it is about promoting loyalty. It is about promoting stickiness with the consumer. The stickiness is done through the perceptions. Perceptions are done or formed based on the experiences. And that's where I personally believe all the EMR platforms fall short. They're phenomenal in terms of data capture with a singular focus on revenue or reimbursement. Not all that awesome in terms of the overall customer journey. So a short answer to this excellent question is, while they do have the capability, but it is not woven in the right fashion to provide the right customer experience across the entire continuum of care. Thank you.
Thank you, KG. And Paul, you briefly mentioned an experience management platform like Adobe Experience Manager. And our audience is wondering if you can kind of shed some more light on where products such as these might be a good fit.
Yeah, so platforms like the Adobe Experience Manager or Sitecore, other platforms that are out there as well, serve a really valuable purpose as a centralized mechanism for creating, storing, pushing content. It's standardized. It allows for, excuse me, I'm losing my voice, allows for great personalization. So it's a way of organizations to create a consistent messaging, consistent quality, consistent design format for communicating and interacting with their patients and potential patients. And then also automating some of the outreach processes that Colin had referenced, and I think KG had as well. So once a patient is discovered and there's a lot of information about that patient, those types of tools allow for the presentation of automated outreach to those patients, leveraging consistent design, consistent quality data, and personalized to that patient.
Thanks, Paul. We're getting close to the hour, so I'll ask one final question. We actually had a couple attendees wondering who should be involved in creating a service blueprint.
Yeah, I'll take that one. Thanks, Elizabeth. Yeah, and I think kind of that gets to the heart of a lot of what is important to address here. Creating a service blueprint requires participation from stakeholders across the organization. That can be hard to do. As KG went through, the 4 stages of the personalized care framework, and he talked about the different technology and data platforms that are at play. you're going to need representation across your organization from all of those folks. But what I always say too is, it's important to find the other people who are thinking about the quality of the patient experience and the consumer experience as well. The technology and the complexity around that is manageable. I think where organizations sometimes struggle is in finding the right champions within the organization to do some of those integrations, to do some of that heavy lifting, or actually sometimes to step back for a moment and think about, do we have the right strategy for our data and how that connects into our platforms and consumer experience. But again, the service blueprint methodology and the way that we go about delivering that really makes that accessible, and it can move relatively quickly. There are both personal workshop ways that we get there, and then there are also automated ways where we start to identify the different systems and actors at play as well. It's a cross-functional effort, but the value that you extract from that over time continues to grow, and the alignment that it helps organizations forge is really, really valuable in terms of delivering better outcomes both for their organization and patients.
Fantastic. Well, I'd really like to thank everyone again for sharing these insights, and our attendees for spending time with the PK team today. So be sure to check your inbox for further resources and assessments in regard to clinical BI and initial ways to contact us to discuss particular interests in improving healthcare outcomes. Thanks again to Paul, Colin, and KG.
Thank you.
Thank you, Elizabeth.
Thanks, everybody.
Thank
Bye.
you.
Great. Bye.